Today on Hand and Wrist TV, the battle of the sexes. Who's more likely to get injured while playing tennis, men or women? These day-to-day activities can simulate the same injuries caused in tennis. Are you at risk? And Pros in Pain. We take a look at the recent injuries on the pro tennis circuit and offer our prognoses. It's time for some serious tennis talk on Hand and Wrist TV.
Hi everyone, welcome to Hand and Wrist TV. I'm Dr. John Knight. Take a look at this player. That's pro tennis player Juan del Potro, the 2009 US Open champion. Pretty phenomenal when you consider he was sidelined in 2010 with a wrist injury that took him out of the game and set him back significantly. Del Potro worked hard and fought his way back to a number 4 ranking in the world. Bad news though for this comeback king, as he recently injured his other wrist and was taken out of the game last month to repair more ligaments. He's not the only one whose injuries are affecting their game. Laura Robson, Britain's #1 female player, is also out for the year, having had the same wrist surgery. And Novak Djokovic, the top player in the world, was sidelined recently with a wrist injury. Happy to say, remarkably, he returned after time off to win the Italian Open last month. Very impressive. These are just a few of the elite players plagued with wrist injuries this year. The wrist is highly at risk in tennis because the force of contact with the ball is transmitted directly through the wrist and coupled with increased torque when a player attempts to put more spin on the ball. Baseline players are most susceptible on long rallies. We see more of these injuries now in players as they are becoming more fit, almost superhuman it seems. And the force they strike the ball with is much greater than the strength of these little ligaments. Wrist injuries are common in everyone who plays tennis, but more so in women than in men. Damage to the wrist accounts for about 11% of reported injuries in men and about 16% in women in one study. But you should know it's not just about the professional athletes who are in danger of these injuries to the wrist. Coming up, how to prevent wrist injuries from happening and what to do if something like this happens to you. Welcome back to Hand and Wrist TV. I'm Dr. John Knight. All tennis players are at risk for injury to their upper extremities, and the wrist is a prime target. Injuries can happen from repetitive use or a single traumatic event. Women are in no way the weaker sex, as my wife will tell you, but in the case of tennis, they are more at risk for wrist injuries because they have looser, weaker wrists. Most injuries involve the dominant wrist, but overuse injuries can involve the non-dominant wrist in the two-handed backhand players. When you get an injury from overuse, typically you injure your tendons. This leads to an inflammation, more commonly referred to as tendonitis. Traumatic injuries usually lead to a more significant damage affecting the cartilage or ligaments. For example, landing on the court after diving for a ball. These injuries are usually seen in the dominant upper extremity, so if you're right-handed, you're more likely to have an injury to your right wrist. If you hurt your wrist, you should follow these basic steps. To reduce pain and swelling, you should ice the area for 15 minutes several times a day. You can also use NSAIDs, or what we call non-steroidal anti-inflammatory drugs like Aleve, Advil, and ibuprofen. These are over-the-counter medications that can also reduce swelling and discomfort. Another step you can take is to immobilize the wrist in a wrist brace. And of course, with any injury, you should consult with a wrist specialist. The most common wrist injuries are first a wrist tendonitis. This is on the little finger side of the wrist, the ECU tendon right here, that goes through a little tunnel. It's within these tunnels that the wrist is subject to stress or inflammation. Within this tunnel, when you get a tendonitis, you get pain when you lift the wrist up or cock it outwards. So when you go to a specialist, after you've done these initial steps that I told you, the specialist will likely put a cortisone shot right into that sheath. You will immobilize it for a couple weeks, and if that doesn't do it, sometimes a surgery is necessary to make a little incision along the outside of the wrist. We go in and we clean off that tendon, and then start rehab right away. Usually it's about a 6-week recovery. On the thumb side of the wrist, there's a common condition called de Quervain's tendonitis. And in this condition, it's painful with thumb movement. When you first go to a specialist, usually there'll be a cortisone shot placed, and if that doesn't do it, frequently surgery is necessary to go in and we cut the sheath right here and open up this tunnel, as you can see here. It's a little 1 centimeter incision. You're in the brace for about a week and then you start rehab. Again, about a 6-week recovery. Finally, there are traumatic tears that can occur, and the most common, as we've talked about with these elite athletes earlier, is called the TFC tear. It's on the little finger side of the wrist, right here, and it causes with a pain with a torquing or supination, pronation rotation of the forearm. So it's pain in this area. Frequently when the patient comes in, we'll get an MRI, which will show the tear, and then we'll start with a cortisone shot perhaps, but frequently these will come to needing a surgery. So through 2 little 1 millimeter cuts on the back of the wrist, we stick a scope in that we're looking at this picture here, video, through a monitor, and then we stick a little probe in and we identify the tear, and then we stick this metal object in and kind of like a roto-rooter and trimming out the tear. Usually it's about a 6-week recovery to return to full tennis activities. All these injuries are commonly caused by tennis. But as a hand and wrist surgeon, I can tell you, I see plenty of non-players coming in with the same injuries. Simple everyday activities like working on the computer, doing yoga, lifting a baby, even using your BlackBerry can cause a tear or a strain. Repetition of many of these common activities can cause inflammation to tendons, just like in sports. Now, of course, the best way to keep your hands and wrists healthy are to avoid injuries. For tennis players, choosing the right racket can make all the difference. Modern-day rackets are made of graphite or carbon fiber. They are stiffer and lighter weight and more aerodynamic. This allows a higher string tension and greater control. The more control, the less likelihood of an injury. Newer rackets have strings made of nylon or gut, whereas old rackets use polyester, which causes more vibration, causing a jolt to the ligaments and cartilage. To prevent unnecessary stress to the wrist, it's key to find a comfortable grip size. If your grip is too small or large, it can cause unnecessary stress to the hand, wrist, and arm. This shows a classic grip, allowing for one finger to go between the tips of the fingers and the base of the thumb. Proper technique is important when it comes to injury prevention. Let's take a look at how properly to grip the racket. You don't want to grab it too tight. The safest grip is called the handshake position. This shows a racket coming at a 90-degree angle off of the hand. This shows another grip of it looking down on it, so it's straight across the racket. Placing the hand in extreme positions can lead to additional stress to muscles and tendons, which predisposes them to injury. Look at this Western grip. This is common in elite players that want to put more topspin on it, so they rotate the hand counterclockwise 90 degrees on the tennis racket handle. This can cause undue stress, causing injuries to the wrist. Next, we'll look at Nadal. This is an important concept. One of the top players in the world, but look at the form. This is the key to successful tennis and prevention of injuries to the wrist. It's called a link system. So force flows from the ground, up through the legs, up through the trunk, out the arm, out to the wrist, out to the racket. If you get too much wrist movement, you break this link, which leads to more injuries in the wrist, as clearly the pros try to avoid. Professional lessons can help refine this technique. Another thing you can do to reduce your chance of injury is exercise. There are no muscles in the wrist, so the USTA has recommended certain exercises to increase wrist strength by actually strengthening the muscles in the forearm and elbow. First, take a 3-pound weight, or in this case, some bands, resistant bands, and you sit down, you simply hold the wrist over the knee, and you do 3 reps of 15 isolated flexion exercises. Then you turn the palm downwards, and you do again another 3 reps of a set of 15 each. However, don't do these just before you play, or you'll risk fatiguing your muscles. Stretching is also key to injury prevention. Each stretch should hold for 15 to 30 seconds. Again, palm down, hold the wrist back for about a 15 to 30 second count, then palm down like this, wrist flexing the wrist. Then you rotate the forearm, again, palm up, Cock the wrist or extend it for 15 to 30 seconds. Same with the wrist flexion. You do this on both sides. These should be done prior to hitting, and after playing, you should also do these while your muscles and joints are still warm. Speaking of being warm, this is critical. Remember to warm up slowly before you play. Do calisthenics or light jog just to get the juices flowing. Then hit in the short court for about 5 minutes and then retreat to the baseline and do some long strokes at about 20% of your normal pace before you start playing a game. Finally, remember to keep the arm warm, as all athletes should, between sets, and then ice is very important after you finish playing. Whether you're a professional tennis player, a weekend warrior, or someone who just puts a lot of strain on their hands and wrists in everyday activities, you can benefit from the education and tips learned in today's show. And remember, if you have questions or topics you'd like discussed on this show, just send us a message on Twitter or Facebook. I'm Dr. John Knight, taking good care of your hands and wrists with every episode of Hand and Wrist TV. See you next time.